E-cigarettes by Damon Michael Wachowski. What are e-cigarettes? E-cigarettes are battery-operated devices that heat a liquid to produce an aerosol in which the users inhale into their lungs. They contain nicotine, propylene glycol, vegetable glycerin, and flavorings. They're not regulated by the government, and the companies can add many different chemicals into the product. They're cheaper than cigarettes and they don't smell as bad, so it's attractive for many people. They don't have tar or carbon monoxide, but still contain ultrafine particles. Not much is known about the long-term effects due to the recent emergence into the market. Are e-cigarettes safe? No, they are not safe. Users should still work on quitting. Again, we don't know what affects developing lungs on young people who consume e-cigarettes. Switching from cigarettes to e-cigarettes may be better, but there's still better methods of nicotine replacement therapy that do not damage the lungs, such as lozenges, sprays, nasal sprays. Respiratory therapists should help people quit e-cigarettes and cigarettes so that they live healthier, better lives. Using e-cigarettes does not worry about tar and carbon monoxide inhaled, but still contain heavy metals and fine particles. In 2021, 30.3% of adults who use e-cigarettes had never smoked a cigarette, according to the CDC. Dual use of vaping and smoking cigarettes is more common amongst older adults aged 45 and older. In 2021, they comprised 42% of dual users. Many youth are attracted to the flavorings added to the e-cigarettes. Many of these e-cigarettes contain nicotine, which is very addictive. 1.63 million students use e-cigarettes in 2024. This includes 410,000 middle school students and 121 million high school students, according to the CDC. Vapes, or also known as e-cigarettes, can cause popcorn lung. Diacetyl, used in some flavors, has historically caused bronchiolitis obliterans or popcorn lung. It scars the lungs. It was historically used in Diacetyl was historically used in instant popcorn from the microwave. It's no longer used anymore. Vaping could potentially cause cancer. It could also potentially cause chronic illness as well, shortness of breath and fatigue when walking or with activity, inflammation, impairment of cardiovascular function and toxicity, airway epithelial injury, e-cigarette or vaping associated lung injury, tissue hypoxia, and abnormalities in lung function can also occur from e-cigarettes. So it's honestly better if you don't inhale anything into your lungs that isn't anything other than air. It's very addictive. Oftentimes, e-cigarettes contain higher percentages of nicotine than regular conventional cigarettes. So it's very hard to stop. They also, whenever you quit, you may gain weight. So a lot of people, after they quit, they notice they gain weight because they're eating more, and then they think, oh, they have to go back to vaping. There's a study conducted by Kundal in 2025. They analyzed the association of vaping e-cigarettes with the risk of cancer in different populations between 2021 and December 2023. They reviewed peer-reviewed human, animal, and cell in vitro and original studies examining the association between e-cigarettes and cancer risk, but excluded qualitative studies. They summarized exposure, acute, short-term, and long-term exposure to e-cigarettes, and considered whether subgroup populations based on various socio-demographic factors of health were affected differently. Two 2 longitudinal observational studies, 9 cross-sectional studies, 1 case report, and 27 cell in vitro and animal studies in adults encompass the 39 studies in the main analysis and 12 in the subgroup analysis. Half of them had a low risk of bias. They found that there was oxidative stress, cellular apoptosis, DNA damage, genotoxicity, and tumor growth. The cancer risk was not found to be different for age and sex. Culture and educational based differences were insignificant. The vaping exposure showed significant biomarkers for cancer risk. The rise of e-cigarettes may require respiratory therapists to study and learn more about the damage they do in order to treat potential future patients. There should be more studies conducted, in my opinion, on e-cigarettes. Thank you very much for listening to my presentation.